is Dr. Farhan Fazal. I'm an infectious disease specialist. I'm working in Mangalore currently. Today I want to discuss to you about few things about coronavirus, which is also called COVID-19, which started in January 2020 from China and it's gone all over the globe and come to India. And in the last 2 to 3 weeks, we are seeing a sudden rise of cases in Mangalore also, averaging from 100 to 200 cases on a daily basis. So today I'm going to discuss to you about few things. What are the signs and symptoms? Where do you test it? What happens to you after you test it? What is the treatments that is available and how to prevent this basically. So starting off with what are the signs and symptoms? Basically this can occur like any other small fever. Fever, sore throat, cough, cold and slight breathlessness to begin with. Remember one thing, I have seen many cases in the families where 4 to 5 members of the family have slight fever, body ache, diarrhea, but they do not come to the doctor. So here is an important point that if more than one person in the family is having a symptom, you should be very, very careful. Also, many of the times the patient tells that this time of the year, in the month of monsoon, they have some amount of rhinitis, some amount of cold, some amount of cough. But at this juncture or at this time, any cough, cold is coronavirus until proved otherwise. So if you have such symptoms, please get yourself tested. Apart from this, where else can you get tested? So there are facilities in the government hospital, Mangalore Hospital is doing it. The private medical colleges, KMC, Yenapoya, Shema, AJ, all the medical colleges have facilities to take the swab and get a test done. And the reports can come from anywhere from 1 day to 2 to 3 days, depending on the load of the system. So it can take 1 day to 3 days. So it takes that much amount of time for you to get the reports. Once this report comes, many times patients also tell us that, is this possible that there is some problem with the reports? So believe me, if the report is positive, it is very, 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 very positive, and it's important that it is considered as positive for coronavirus or COVID-19. It does not mean that the report is wrong. Many times I've heard families saying that we haven't gone outside the house for the last 3 months, but the report is still positive. Believe me, if it is positive, consider it as positive and do it accordingly. What happens after you get this test done? So right now you can get the test done in an OPD basis also. You can walk in if you have cough, cold. You can walk in, give the sample and go back home and stay in home. We have also seen patients who have given their swab, they have symptoms, but they still go to work or roam around in the city. That should not happen. Remember, it's your responsibility to make sure that your fellow human beings and your fellow neighbors do not contract the disease, because you might not suffer greatly from it, but your neighbors or your friends might suffer greatly from it. Another important point is the fear that if you get coronavirus, everybody is going to die or nobody is going to die. Both extremes are bad. So to tell you in perspective, 80% of the time it will be a mild disease, that is little bit cough, cold, that's it. So 80% of them will have such symptoms and nothing else will happen. But 15 to 18% of the people will require some amount of hospital stay with some amount of oxygen. 2 to 5% of them will require ICU care, and 1 to 1.5 to 2% of them will die. In the city, there is a fear that all of them are dying. The problem is nobody is showing you the real numbers. The number, if you see the number of cases that are positive and the number of deaths that are there, it is quite proportionate to the numbers I already told you. After the tests are done, a few days back there was government orders of the availability of home isolation. So there is an eligibility criteria. To name a few of them is, if you are less than 60 years age group and you don't have any chronic lung disease, heart disease, and you're not on any major immunosuppressive therapy, and you have an attached bathroom and some caregiver and a pulse oximeter and few other things. There's a big list of things. If you have these things, you can be at home and consider home isolation. Now again, this is important. This does not mean that you should not test yourself and be at home. Test yourself, get help from the government side or the private sector doctors, and you can be at home, and not everybody needs admission. But for those who require admission, please take good care of your health and get admitted. After admission, usually the discharge criteria vary. So from symptom onset, 10 days is the time where you need to be admitted. With the last 3 days, you should be not having any fever. So that is where you will get discharged from the hospital. The fever can last up to 7, 8 to 10 days also in some cases. And usually during the second week, there is a chances that you might have some complication like breathlessness. Now, many patients ask us whether the government Venlock hospital is good or private hospital is good. they are equally good. There is no good and there is no bad. Both of them are doing excellent job. It's a very difficult time for everybody because as you and me, I am also scared for my health, for my family's health. So all doctors, nurses are taking utmost care for the patient. So there is no difference of hospital care between government hospital and a private hospital. Both are equally good. Wherever you are, wherever you want and where the beds are available, please go ahead and get admitted yourself. After that, there is also a question about what do we do if we decide to stay at home. So if you decide to stay at home, you should have a single room with a bathroom. You should restrict your movements and everything inside the room itself. Do not exchange food. I mean, you can always take food inside, wash the place or use throwable plates and this thing for using for the food. And the clothes also can be washed after a week or 10 days once together itself. Apart from this, for precautions, please make sure that you are wearing a mask. For all practical purposes, a mask has to be always worn. Keep washing your hands on a regular basis and only then will we be able to fight this battle. And this battle is going to be there not for the first 2-3 weeks, it's going to be there for months and months together. So don't shy away, don't get tired as of now. Keep working towards it and hopefully, inshallah, we all will be fighting and coming out of this in a very, very good manner. With the help of the NGO and the district administration and other doctors, we are also starting this wellness program where we will be providing facilities like consultations, help create awareness among patients, also having a helpline where the patients or the people who have doubts and difficulties can give them a call. The NGO is also going to help in regards with other services like trying to know the bed status in the hospitals, and many other services will be provided through the NGO. So all of you please make use of this and hopefully we'll be able to come out of the situation at the right time.